BW Healthcare World Series on Quality, jointly organized with KAHO. This is Arvind Narula, and I have with me today Dr. Arun P Swami, who is the Executive Director of KMCH Hospitals, Coimbatore, and the Director of Aosta. He is a doctor by profession, and he has got his master's in business administration in healthcare systems. With more than 10 years of experience in medical administration, IT systems, etc., he provides the clinical insights and process guidelines for Aosta in product development and ideation. He is instrumental in setting up the quality and new ICT measures in KMCH. Let's speak to Dr. Arun about digitization and what benefits it has on healthcare delivery institutions. So Dr. Arun, thank you so much for taking out time to speak with us at BW Healthcare World, where we are doing these conversations around the quality at an hospital or a healthcare institution jointly with KAHO. So Dr. Arun, I know you are evangelizing the concept of digitization, and we understand that digitization is imperative in today's day and age when it comes to healthcare institutions. Can you provide an overview for our audience in terms of how digitization has already transformed healthcare in the past few years?
So let me put it this way. When I first came out of my training, we were talking about electronic medical records in the United States and digitalization. At that time, it became very unclear for providers. We're doing a lot of digitalization and making everything electronic, but what real benefit does it have? Can I see more patients? Does it hamper me from seeing patients? Does it slow me down? And then the benefits were there, but the benefits were not for really the individual. It was for the overall healthcare system. We can share a lot of records. The system worked a little bit better, but the individual doctor slowed them down. For the patients, they wasn't really that beneficial. They didn't get a better patient experience. What I'm seeing now in about the last 5 years or so is that we're slowly moving more for AI and smart programs. So the trick is now that it's not about digitalizing your record. You're putting your record electronically and then seeing what your heart rate does, but then creating a system of alerts. Now he has an irregular heartbeat. Now I can detect a cardiologist. So now it becomes, there's a lot of blood pressure, or I can create warning signs before a patient gets sick. That allow AI to kick in. AI will help us with quality, but for that to work, we have to digitalize. We have to make everything electronic so the AI can help it lead into the AI. To make that AI is not to replace the human beings, it's to help them. Right now, we're at a point where, to be very frank, the world needs nurses, and India is the biggest source. So we're looking at attrition rates because the Indian nurses, after 2 years of experience, are invited to go to Westernized Europe. They're getting visas for Gulf. They're going to get it for Japan. The whole world is aging. And so we need to have things which should back up programs to help with our helping nurses and improving the healthcare. So we have a lot of digitalization. So we have a lot of platforms where we automatically track patient vitals, and that helps a nurse see if something go wrong. You can detect them early, and you can send them to the ICU, or you can interfere and prevent the patient from deteriorating. So this is only possible if you digitalize. Similarly, we're now breaking things through in healthcare, in insurance, and the back office administration. So now that we can upload records and move it through the insurance process faster. So this was not, even if we digitalized 15 years ago, this would not be possible. But now that our insurances have kept caught up in India, now that the benefit of digitalization makes it much more beneficial. We don't have to, now that India has over more than 50% insurance patients, now we can scan in patient file copies and send it for the insurance for approvals, and they can see our records. So the process works a lot smoother. This wasn't even possible 15 years ago. So we're going to a platform where AI and other things, it's not just about digitalization, but once we digitalize, now we have a lot more tools that we can use.
And Dr. Arun, when we're talking about digitalization, I understand, there are these remote monitoring devices. Now there are also these IoTs, etc., and it is helping the doctor make better decisions and lower the errors. But apart from that, for the healthcare delivery services, what is the advantage that digitalization has brought in? Especially, what is the advantage when the institutes or the healthcare delivery institutions start sharing these records with each other, if they do?
Well, I think that one good example is the Taiwanese healthcare system. They have now a smart card or digitalization card. This is what the Prime Minister is trying to introduce with their programs. With that smart card, it makes insurance processing faster. It makes record finding faster. And when you do that and you simplify the system, it becomes like UPI. It becomes a much cheaper and it brings down our admin costs. So we're spending less time on admin and more money on patient care. So I think in digitalization helps in administration, a lot of functions. And then, one of the things my old professor used to say was, I like to protect my patient against regulation. That's one of the things he used to say. But what digitalization does is that we can now individualize by entering enough patient details, information on you, your name, age, character, family history. It can create a screening risk for the patient and identify programs for that patient, whether it's in, say, on the health aspect, weight loss programs. If it's a diabetic, it can create them food and nutrition programs to keep their blood sugar down. It can individually tailor. So we call it personalization of healthcare, but that's only possible once you digitalize, I think. So once that data comes in, we can start doing these things for the patient. This wasn't really possible since, we couldn't do devices before, but now we can. And now that links into people's smartphones. Now that they have a device, they can afford a smartphone and everything's becoming much cheaper. So we're now on a little bit of revolution. So digitalization is now becoming much more important in the next 10, 20 years, much more important than it was even 10 years ago.
And Dr. Arun, while we understand the importance and the advantages of digitization, are there some challenges that we face or the disadvantages that people are scared of or fearful of, and which keeps them away to adopt digitalization? I mean, especially for smaller institutions that could be in healthcare delivery, smaller nursing homes.
Definitely. So the big problem here, even when I face it in big hospitals, is, we can't easily just say buy 100 computers or 1,000 computers or put intact Bluetooth devices. The patient instantly asks, what do I benefit for that? How do I benefit? And we can't say quality. He's like, are you giving me a better medicine? So it's like there's always, the opportunity is not there in some institutions. So as I said, we're investing much more in digitalization than it was 10 years ago. 10, 15 years ago, you could digitalize your health records, but what were you going to do with it? So only now that, it's becoming cheaper and more affordable, like for the most common thing I commonly see in our diabetic patients is now they wear a patch. The patch is now takes blood sugar over 3 days, and it feeds it into their cell phone and it creates a digital copy for the doctor, and the patients use it often. This is even used by small primary care doctors. So once we get into these small, cheaper things which can be used at a smaller scale, then we're going to have importance of digitalization. So a lot of our devices now we're building in with smartphone friendly, because a lot of Indians have smartphones. This wasn't the case 10 years ago. So we're going to go through a lot of aspects. Digitalization of healthcare sometimes can be a very expensive, big process, but we're trying to find it cheaper. And I think there's a lot of innovations on the cheaper end, but it's going to take time. But I think it's definitely on its way.
But Dr. Arun, are there some personal experiences or case studies that you have observed in your organization that illustrate the impact of digitalization on patient care and also operational efficiency that you may have achieved through digitization?
Definitely it helps with our audit process. We do a lot of audit, like that means we have to do skill and then see what patient outcomes are. Once you have the data completely in your computerized system, you can see what audit processes you have, how long a patient has been there, what digitalization. You can easily pull the data. So it's helping with our audit and quality processes right now. It is not the only way we do audit, but it is a big part of it, of the data that's captured in it is now available for audit. Otherwise, it's a lot of manual extraction and manual data. It's still possible, but it makes it extremely difficult. Now we're able to do double checks and quality checks and see what turnaround times and things like that much more better. So our efficiency is helping. So now that we can see if a patient has come back, like we can digitally audit into our system how many patients came for that were advised that to come for an angiogram, and then how many actually showed up later. How many got scared and ran away or went to a different hospital. Going to a different hospital isn't a big issue, but getting scared and not coming into the hospital, to any hospital, is a big issue. So then we're able to do a little bit more quality checks. So that's our biggest process is now in our audit and research purpose. We can actually bring people back and we can find out what's going wrong in our system. So this is pretty much what our biggest use case is. So we're doing continuous tracking, when a patient comes in, how fast do they get an angio, or how fast can they do a stroke? And then we publish the time for our doctors and they continuously try to improve it. So the department improves on upon itself. So right now, our strength right now, and I would say in digitalization, is our auditability. That means we can take back data and quickly review it, and then you publish it and use it to improve ourselves, which is not possible if it's like manual. It's still possible, but it was still done back in the day, but it took a very long time. Now it's automatic.
I totally agree with you. I think, one of the advantages of digitization that we have observed while I'm talking to people is that, we are able to address the efficiencies and achieve the three challenges that we have in the healthcare system, whether it's the access or standardization of the treatment protocols, and third is the affordability. If we are able to reduce the cost, we'll be able to, transform that benefit to the patient as well. But talking about digitization, digitization creates a lot of data. There's a lot of data that is collected, which is where AI becomes very, very useful. And for AI to be useful, we want more and more data of our patients and of whatever we are doing in the hospital. That brings up the challenge about privacy and security of the data, which is prevalent in the healthcare industry. How are you, or how do you think, what would be your approach towards data privacy and security at your own institution?
It's our number one concern, I think. In India, it's like number one concern is like people sharing each other's passwords in the office. So definitely it's a massive concern for us. And to be very open, it's not a safe environment anymore. Almost everyone knows about the AIMS cyber attack. Huge number of institutions, including ourselves, cyber attacks have been attempted in the past. So we're going to have to spend a lot on cybersecurity. You have to do a cybersecurity audit. You have to make sure there's multiple levels of safety. And then you have to carry barriers. That means like you have to be no sharing Wi-Fi passwords, biometric identification, no inputting free USB. Can't let the employees use Google and Yahoo all over the network computers. So there's a lot of things we have to do on the patient education side to make sure keep the patient data safe. So privacy is a huge challenge in this environment. We're still working on aspects. So every MOU agreement we do, we have to make sure that they're not going to share patient data. Patient data is not going to be used for financial purposes. So this is a big thing, which is very important. Companies are going out there and paying for patient data, but we are trying to prevent our patient data from being leaking out. So there's a big challenge, but I think that shouldn't prevent us from looking at the opportunities.
And Dr. Arun, as a business leader at an healthcare delivery institution, and also being a doctor, how do you see the emerging technologies as AI? And I am consciously using the word emerging technologies while AI has become a buzzword, because there's a lot that needs to happen before it really moves towards real artificial intelligence and also machine learning. What do you think will be the role that it will play in the holistic delivery mechanism in a hospital when it comes to the role of a doctor and non-medical role, patient safety, patient security, outcomes. What do you think will happen in the future?
I think AI is going to provide a greater role. So far, I think recently I just heard of 2 case studies where it was used. One was to check your eyes. That people often visit the doctor for their diabetes. Everyone with diabetes has at risk for something called diabetic retinopathy. They have to go see an eye doctor. But actually, very few patients who leave the doctor's office after being diagnosed with diabetes actually go to the ophthalmologist. They're not getting their eyes checked. So there's an AI device. You can go and sit in the doctor's office. You can just take a look inside, and it takes the pictures of your eyes. And it just prints out 2 things, high risk and low risk. If it's high risk, means you definitely need to go see a doctor. So this is one case study where it works within the workflow. So right now we're trying to get AI into our workflow, which is not quite there yet. We talk about AI, it's pie in the sky. Another one is coming out of England. In England, I believe that they need 2 radiologists are required to read a mammogram. So recently they did a study where it's 1 radiologist plus an AI computer. So it cuts down the work by half. So when you talk about national health budgets, that means the number of radiologists required, 1 radiologist can do more. 1 computer program can double check. So we're going to see this applied more and more in pathology and more in radiology. Right now it's limited applications, but one by one, we're going to find more and more where these applications are going to come out. And we're going to see where it's going to improve we're looking specifically at things which are going to improve our workflow and cut costs for our patients. So it's not going to be an overnight revolution, but it's going to be a slow revolution of applications that's going to appear time and time again, and then that will build up to an overall revolution.
Dr. Arun, before I let you go, my last question to you is around what is ahead. Basic digitization is being done in almost every large institution. But what are your top priorities as a business leader and your goals for further digitalization, digital advancements within your organization, and how do you plan to achieve them?
So how do I plan to achieve it? This is kind of a not so easy question because you're kind of stuck between a rock and a hard place. You can't get to AI until you digitalize, and unless you digitalize, the money is not going to show up right away. It's going to be in slow things in quality aspects. So, if I automate a process, am I really bringing down the quality? Does it really make a difference to the patient? What are my actual patient outcomes? So about 10 years ago, we were hesitant. We were very careful with our dollars. Now we're getting to the point where India is a little bit more affordable and the technology prices come down. So it's becoming a lot more affordable. Recently in our hospital, we were allowed to put in Wi-Fi 6, which means I can go to Bluetooth trackers and I have automatic Wi-Fi available all over the system. So it's becoming a lot more prevalent. Patients are becoming more friendly. Everyone has UPI, everyone has Aadhaar, everyone has now those new driver's licenses with the smart chip so that you can just swipe your driver's license and it'll pull your data. So registering your data. So once and by one, it's becoming, we're going past the tipping point where now India is now being finally able to fully utilize it. And more importantly, the cost prices are coming down. So we're a little bit hesitant. We're not going full force with it. We're still being an early adopter rather than being a true pioneer. But I think it's the way to go. And I think that we're in the point of an evolution. And only once we digitalize, everything will then, we're now in the place where applications are now being built. So it's not like an easy solution. It won't be the same solution in every city and in every state and every institution. So for my institution, we decided now is a much stronger point than ever before. So we're pushing for more digitalization right now than we'd ever did 5 years ago.
Dr. Arun, I want to go back to where we started the conversation that digitization is imperative. The benefits are known for the institution, for the doctor, for the patient, uh, to build efficiencies and to build better outcomes, to help patients get better, faster, quicker. Uh, there are challenges, but I think what we are seeing today is that post-pandemic, most doctors and patients have started using technology. So the acceptance is going to be quicker, is my guess. And institutions have also started seeing the benefits of digitization in their institution. So I think it's a journey that is well begun, and but there's a lot that needs to happen. All the best. Thank you so much for sharing your thoughts with us, and let's hope that we'll be able to see a more efficient healthcare delivery system soon, thanks to digitization.
Thank you for having me.